Do you feel neoplasm or cancer coding is difficult? If you feel difficult, please mention in the comment section where do you feel neoplasm or cancer coding is difficult. And today's session will be very useful for SCC coders, IP coders and OP coders. After watching this complete session, if you like this one, please click on like button and also please share it with your friends. In today's session, initially we will start with definition of neoplasm. Next, we will learn causes of neoplasm and we will see risk factors related to neoplasm. Next, we will learn signs and symptoms related to neoplasm. So next, we will learn diagnostic tools as well as treatment and ICD-10 CM coding guidelines. And this session will be useful for the live coders who are currently working as medical coders as well as the coders who wants to attend numerous medical coding interviews. So definition first. Neoplasm. What is neoplasm? Basically here neo means new. Plasm means tumor. So new tumor or growth. A new growth of tissue that serves no physiological function. Okay. So basically neoplasm is a new growth of tissue. So with this tissue there is no use or it does not perform any physiological function. And these neoplasms will be benign and malignant. Benign neoplasms will grow in only one place and they will not spread or invade to other organs. But these benign neoplasms will not invade or spread to other organs, but they will create problem by pressing the other vital organs. And if you remove or excise the benign neoplasms, they will not reoccur. Next, we will learn malignant neoplasms. So basically, malignant is opposite of benign. So malignant neoplasms will grows, spreads and invades other body parts and can reoccur. So these malignant neoplasms will be gross, okay, and they will spread to nearby organs as well as they will invade to other body parts and they can reoccur after the definitive treatment, basically using radiation or chemotherapy or excision of the cancer. Next, we will learn cancer. So what is a cancer? A malignant neoplasm of potentially unlimited growth that expands locally by invasion and systematically by metastasis. So basically, cancer is also a malignant neoplasm which is having unlimited growth. So there is no end to its growth and it expands to other vital organs and nearby structures. Most of the time it will metastasis, means spreading to other organs. Next, we need to understand what is metastasis. So the spread of cancer from one part of the body to another is called as metastasis. And also during pathological analysis, cells of the metastatic cancer are the same as the cells of the original cancer. So here metastatic means secondary. So here basically secondary cancer as well as primary cancer cells are same. Based on this criteria, pathologist will decide which is primary and which is secondary. Next, we will learn what are the causes of cancer. So basically cancer is caused by changes to the DNA within the cells. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. WhatsApp group link is in the description of this video. And also if anyone looking for medical coding trainings include same day surgery coding training, IPDRG training, SCC training and CCS certification training, please contact 707-526-3939 for trainings. Next, what are the risk factors for cancers? So basically risk factors mean what are the causes of cancer. Mostly there is no particular cause of cancer is unknown, but the following are the general risk factors for cancer. Age 65 or older, okay, but mostly we can diagnose this cancer at any age. Lifestyle and habits. If you smoke, if you have sun exposure, if you use alcohol, if you have obesity, if you have unsafe sex, and also if you don't have physical activity, you are mostly vulnerable to get this cancer. And if your patient or if you are having family history of cancer, it will be one risk factors for cancer. And also some chronic health condition will lead to cancer, and also if you exposure to chemicals, toxins or radiation leads to cancer. Next we will learn what are the signs and symptoms of cancer. Okay, basically signs and symptoms depends on type, location and stage of the cancer. So basically what is stage here? Stage refers to how much the cancer has grown and spread to or invading to other organs. Next, how do we identify cancer? So most of the time biopsy is the primary service. After biopsy, physician will perform the pathological analysis, which is the primary diagnostic tool for cancer identification. Then, based on biopsy report, we will do lab test, and afterwards, if biopsy and lab test are positive, we will do diagnostic imaging like X-ray, ultrasound, CT, MRI, and PET scans. So basically, these diagnostic imaging are the confirmation of these pathological and lab test results. Next, we will learn treatment. So, how do we treat cancer? Okay, so basically, cancer will depends on type of cancer, whether it is benign or malignant. Also, location and stage. Where is the location and stage? For example, if the patient is having less or first stage cancer, so the treatment is less severe than severe stage cancer. And also the cancer treatment may include surgery. This is the final treatment for cancers. Chemotherapy, immunotherapy, hormonal therapy, targeted drug therapy, radiation, stem cell transplant, as well as some combination of both chemotherapy as well as immunotherapy, or immunotherapy plus hormone therapy. So sometimes basically physician may perform different types of therapies in order to treat cancer. Next, we will see ICD-10 CM guidelines. As all of us know, these neoplasms are included in Chapter 2 of ICD-10 CM official coding guidelines. The code ranges from C00 to D49. In today's session, we will learn admission or encounter for treatment of primary site. How do we code this scenario? And also we will learn admission encounter for treatment of secondary site, coding and sequencing of complications, primary malignancy previously excised, admissions involving chemotherapy, immunotherapy and radiation therapy, admission encounter to determine extent of malignancy. And also we will learn symptoms, signs and abnormal findings listed in chapter 8 associated with neoplasms. In second part, we will learn H2T. So chapter 2 Neoplasm C00 to D49. So first we will see few general guidelines related to neoplasms. So basically chapter 2 contains benign as well as malignant neoplasms. So if you are new to medical coding, just remember C or C series in ICD-10 CM are mostly related to malignant neoplasms. Okay, and D series in ICD-10 CM mostly related to benign neoplasms. For example, in the report, if we see prostatic adenomas, so you will not find prostatic adenomas in chapter 2. You will find it in the specific body system chapters. So, if you want to code neoplasm properly, it is mandatory to check the record in order to determine if the neoplasm is benign, in situ, malignant or of uncertain histologic behavior based on the pathology report. And if the neoplasm is malignant, we need to check for secondary or metastatic sites. So, if a malignant neoplasm overlaps two or more contiguous sites like next to each other, so that time we need to use point it in our ICD-10 CM code. So point 8 is for overlapping lesion. Contiguous means next to each other. For example, if the documentation contains malignant neoplasm is not contiguous. So we need to code it in multiple codes. For example, if you take breast, in the breast we have 4 quadrants. For example, if the patient is having malignant tumor in first quadrant and third quadrant, we need to code them as separately. Next one, malignant neoplasm of ectopic tissue. For example, patient is having ectopic pancreatic malignant neoplasms. Okay, so which will spread to stomach. So that time we need to code malignant neoplasm of pancreas unspecified C25.9. Even though cancer spreads to stomach from the pancreas, we need to code it as pancreatic cancer as this is the ectopic pancreatic cancer. So whenever we want to code cancer or neoplasm coding, we need to use the appendix index or neoplasm alphabetic index. And also we need to check neoplasm table in the ICD-10 CMC book. So if you don't know how to use neoplasm table, please mention in the comment section of this video. I will create one video related to neoplasm table. Next, we will learn how to code if the patient's admission or encounter for treatment of primary site. So basically, if the malignancy is the primary region for patient's encounter, we need to code it as primary code or primary site. So basically based on the medical necessity, but we have one exception. If the patient came in for administration of chemotherapy, immunotherapy or external beam radiation therapy for malignancy, that time we need to code administration of chemotherapy, immunotherapy or external beam radiation therapy Z codes as the PDX. Next, we need to code reason for the this chemotherapy, immunotherapy or external beam therapy, like what is the reason for this therapy. So what is the type of cancer here. So basically in this section, first you need to code Z51 series, which is for administration of chemo, immuno or radiation therapy. Next you need to code reason for chemotherapy or immuno or radiation therapy. So Z code first followed by C code. Next one, admission or encounter for treatment of secondary site. So basically this is the primary site. If the patient came in for treatment of primary site, you will code primary site as the PDX. And if the patient came in for treatment of secondary site, so you will code secondary site as the PDX. So this is simple. Always you need to check what is the main reason for the encounter, whether it is primary or secondary. If the patient's encounter is for primary site treatment, you will code primary site. If the patient's encounter is treatment of secondary site, you will code it as secondary site as the PDX. So sometimes what happens, patient came in for treatment, okay, and here patient might have primary as well as secondary site cancer. So but the patient's encounter is for exclusively for secondary site treatment. So that time you need to code it as secondary site as the primary diagnosis followed by primary site. So basically which is simple. In the documentation you need to check what is the patient's reason for encounter and what physician has performed. If the physician performs treatment of primary site, you will code primary site as the PDX. If the physician perform treatment of secondary site, so you will code secondary site as the PDX. Simple. Next, we will learn coding and sequencing of complications. First one, anemia associated with malignancy. So, if the patient's admission is for management of anemia, so which is associated with malignancy, then we need to code anemia as the PDX, where physician will perform treatment for only for anemia, not for the malignant neoplasm. So this is very simple, anemia associated malignancy. Basically, for example, patient is having breast cancer and also because of that patient is having anemia. But in current visit, physician will treat patient's anemia only. He will not treat patient's breast cancer. So that time we will code breast cancer as the PDX followed by anemia as the secondary code using D63.0 anemia in neoplastic disease. So simple here, breast cancer is the PDX, anemia as the secondary code. Next guideline, anemia associated with chemotherapy, immunotherapy and radiation therapy. So for example, patient is having the breast cancer and is undergoing treatment using chemotherapy and immunotherapy or any type of radiation therapy. During the treatment, patient may have anemia due to this chemotherapy, immunotherapy or radiation therapy. Then how do we code? So in that scenario, we need to code anemia as the PDX and followed by adverse effect of neoplasm using T45.1 into 5 as the secondary code. So here anemia primary code, adverse effect of anti-neoplastic and immunosuppressive drugs as the secondary diagnosis. Simple. So what is important here? We need to check what is the reason for the encounter and what is the underlying cause for anemia. For example, patient is having the breast cancer and he is taking the radiation therapy treatment. Okay, so because of this radiotherapy, patient will have anemia. Not to all patients, few patients might have anemia. So if the patient visit is for treatment of anemia, we need to code anemia as the PDX followed by Y code for radiological procedure and radiotherapy as the causes of abnormal reaction of the patient or later complication. So here basically you need to check what is the underlying cause of the anemia. If it is chemo or immunotherapy, you need to code T45.1 as the secondary diagnosis, anemia as the PDX. Okay. If the patient's anemia is due to radiotherapy, you need to code anemia primary code followed by Y84.2. So for example, management of dehydration due to the malignancy. For example, patient is having the breast cancer and also because of management of this one, patient will have dehydration. So in the documentation, if you see dehydration due to malignancy or breast cancer and the current visit is only for dehydration, you need to code dehydration as the first followed by malignancy. So how do you code this one? If the patient treats patient only for dehydration, you will code dehydration as the primary diagnosis followed by breast cancer as the secondary diagnosis. Next guideline, treatment of complication resulting from a surgical procedure. Okay, if the patient's current encounter is for complication due to surgical procedure, we need to code complication as the PDX. If the patient performs treatment in order to resolve the complication. Next guideline, primary malignancy previously excised. So for example, patient is having breast cancer. Okay, in 2020, now 2025. So in 2020, patient undergone mastectomy in order to treat breast cancer. So that time we need to code Z85 series of codes, personal history of malignant neoplasm. For example, if the patient is having surgery in 2020, we need to code Z85.3 for history of breast cancer. We will not code current cancer as patient had already undergone mastectomy in 2020. In 2025, we will code it as history of breast cancer. For example, patient's breast cancer is excised, but before that, if that breast cancer is spreads to or metastasis to another site, which we need to code it as secondary site, and along with that secondary site, we need to code Z85 series is for primary cancer, which we need to use it as secondary code. Okay friends, thanks for your time. So I will stop here. In part 2, we will learn remaining topics or remaining guidelines related to neoplasms. And if anyone looking for same day surgery training, IPDRG or inpatient SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button.